Hello, and thank you so much for joining me today for this presentation on IASIS Neurofeedback. I'm Trevor Halsauer. I'm a family nurse practitioner, owner, and nurse practitioner here at Valley Vital Medicine. And we are a functional medicine practice here in Fargo, North Dakota, and we have a lot of different things that we do here. But today, I specifically am just really excited to do this presentation on IASIS Neurofeedback. It truly is one of the favorite things that we do here in our practice that, frankly, we just see incredible, amazing results with. And so I'm excited to share a little bit with you about what this technology is, what it does, and just some of the benefits that we see from it. So let's go ahead and get started here. First, a little disclaimer. This information is for educational informational purposes only, and it is solely supposed to be used as a self-help tool for your own use. So we are not providing medical, psychological, or nutritional therapy advice through this presentation, and you should not use this information to diagnose or treat any health problem or illness without consulting your own medical practitioner. So always seek the advice of your own medical practitioner or mental health provider about your specific health situation, or feel free to reach out to us, and we'd love to see if we would be a good fit for you as part of your healthcare team. So background of IASIS, what it is. So in 1924, Hans Berger discovered the EEG, which is a safe, painless test that measures brain activity, which is pretty cool. It's fun to be able to know that, hey, we can actually have insights into how the brain actually is functioning or working. So biofeedback, which had its beginnings in the 1950s, is the predecessor to neurofeedback. The original intent of discovering neurofeedback was for seizure disorders and later is used for ADHD. So neurofeedback has evolved over the years due to technological advancements and discoveries. And IASIS Microcurrent Neurofeedback is the current cutting-edge innovation in bio and neurofeedback. The ease and simplicity of treatment distinguishes IASIS from traditional neurofeedback. So as we're going to talk about here in a minute, traditional neurofeedback that a lot of people go out and do is very intensive. It requires a lot of time. It requires a lot of brain energy. And really, IASIS is differentiated because it just doesn't require as much of that. So Barry Bruder, who is the founder of IASIS, developed it after being a lens neurofeedback provider. He noticed that the therapy was overstimulating many of his clients, and which caused him to experiment with the idea of sometimes less is more. So if you think about it, we as Americans a lot of times say more is better. Not always the case, right? So IASIS Microcurrent Neurofeedback was born out of this and is based in the concept that the nervous system responds positively to sometimes less stimulation. So he launched IASIS Technologies with his wife in 2010. So it's been around now for about 15 years. So since then, IASIS has spread with thousands of practitioners across the United States and also around the world. So this is not a new thing. This is not something that very few people know about or do about. This is something that's very significant. So what sets it apart? What makes it different from other therapies, other neurofeedback that potentially you've heard of? So IASIS specifically is based on the principle of hormesis, which means that we administer the smallest possible dose to achieve the greatest possible outcome. So in other words, like I said earlier, less is more. So generally, the smaller the stimulation we do, the more effective the outcome, and without all the negative side effects. So in contrast, other neurofeedback modalities often will overstimulate clients and take much longer to see results. So compared to other neurofeedback techniques, IASIS is passive for the client. It uses direct neural communication, is broad, and it's non-specific, and it's very, very gentle. So there's no contraindications. It's completely safe for children. So in our clinic, we've actually done kiddos as young as 4, 5 years old, as long as they know enough not to pull the weeds off their head, all the way up through elderly, and it's completely safe in pregnancy as well. And many people see improvements very, very quickly, sometimes in as little as 1 to 3 sessions. Though enduring sustainability, in other words, when you have enough of the benefit from the therapy, usually will take a little longer, usually somewhere between 12 and 20 sessions. So let's compare here directly to what the difference is between IASIS neurofeedback and traditional neurofeedback. So, like I mentioned earlier, in regard to patient involvement, IASIS neurofeedback is very passive. So what that means is you come and sit down in the chair, you relax, the technician puts the leads on your head, and you just sit back and relax and just kind of enjoy the experience and just give your body the chance to relax. Traditional neurofeedback, on the other hand, is very active. So in other words, it's really hard. It requires a lot of concentration, a lot of brain feedback, and frankly, a lot of people find it very difficult. So the number of sessions is also very different. To get enduring sustainability with IASIS neurofeedback, generally we're looking at 12 to 20 sessions. So again, enduring sustainability means that you don't need it anymore. Whereas traditional neurofeedback, you're generally looking at closer to 30 to 60 sessions. IASIS also treats the entire brain, whereas neurofeedback is going to focus on one specific little area. IASIS also has very little reactivity, to potentially none. And I would say none is what we see most often. Versus neurofeedback, because of its intensity, can cause excessive reactivity. So side effects with IASIS are quite rare. And with traditional neurofeedback, people see that overreactivity quite regularly. In the experience curve, IASIS, so it's super easy. Again, you just sit in a chair and just come and experience it. Whereas traditional neurofeedback, you need to learn that therapy as you go. So return on investment, you will notice that you are achieving your goals within as little as 3 to 6 months, versus traditional neurofeedback can take 1 to 3 years, which is quite significant. So benefits of IASIS, conditions for which IASIS has been found helpful. And really, I would say that it's quite significantly beyond what even is listed here. But emotional regulation, particularly in anxiety, PTSD, addiction, autism, OCD, depression. We've even seen significant benefits in some of our clients with suicidal ideation, alcohol, drug addiction, those kinds of things. We've seen improvements with ADD, cognitive decline, TBI, and specifically, I've actually used it in my own son for after he got a concussion, and that seemed to be a turning point in which he noticed that he'd seen some benefit. We also can see benefits with anger, autism, Tourette's, different tic disorders as well. Insomnia, I would say that improvement in sleep is definitely one of the more common things that we see improvements of. Cravings, fibromyalgia, chronic pain, because that generally is a neurologic overfiring of the nerves. We can see a lot of benefits there, as well as with chronic fatigue. We also have the ability to see a significant improvement just in general brain function for those who are just looking to optimize their brain for peak performance, whether that's athletes or potentially people who are executives, have a high functioning job at work, or think about students in school, college students, improvement in the ability for the brain to be able to function quicker and to be able to have better recall. Parkinson's and other tremors, I've definitely seen this as well as being a significant benefit with IASIS as well. Some of the other benefits that we likely can expect to see is improved focus, reduced anxiety, sleep, creativity, and memory. So who doesn't want those things? And frankly, this is one of the therapies that I see do the biggest, most amazing things with so many of my clients. In fact, recently I had a conversation with one of our clients who she had come in and just had really felt that by doing IASIS allowed her the ability to heal in her own way, to heal in her own terms, and has just offered her so much freedom in just processing and being able to gain introspect into herself and into her health. And it's been such an amazing healing journey for her. So this is one of those therapies that I'm just really, really excited about. So how it works. So IASIS is classified as a low intensity pulse using transcranial electrical stimulation. So what it does is it utilizes a minuscule amount of electricity, basically a millionth of what's in your cell phone. Okay. And it targets high delta brainwaves, which may alleviate symptoms across a range of conditions with a potential path to improve wellness. So the delta waves in your brain, if you think about it, a lot of people will hear about delta waves for sleep, but it also has a huge role to play in regard to that fight or flight mechanism within your neurologic system. So when you come in, what we do is we place those electrodes on different points around the head using EEG paste. So it's just a little bit of a minor sticky goo, which goes in different spots, but it comes off really, really easy. And then you're able to view your brain waves during the EEG session or during the session on the computer that we use. The treatments are painless and imperceptible. Really, you don't notice that anything is happening at all. And you get to really enjoy just a relaxing and a calming environment. Now, like I mentioned, that those delta waves, that stress, fight, or flight stage. What this is doing, and by utilizing this technology, it is untraining your brain out of that stress, fight, or flight response, which is cool because it's actually fixing your brain. And so it stimulates neurogenesis. What does that mean? It stimulates your brain growing and becoming more plastic. So in other words, the connections in your brain can change and evolve and move so that they're more efficient. Helps to balance out that autonomic nervous system. So again, thinking about getting out of that fight or flight and into the parasympathetic, which is that rest and digest stage. That really is the ultimate goal of what IASIS Neurofeedback is doing. It enhances the function of neurons. It promotes glymphatic function. So that is the drainage of toxins in your brain. It targets the entire nervous system, and it facilitates the recovery from the dorsal vagal freeze, so a native state caused by prolonged trauma. IASIS Neurofeedback has been incredibly effective in those clients of ours that have experienced trauma. So what to expect at your first session. So you will do an initial intake. Now we have a couple of technicians here that do the intake with you. So myself or other provider that is here at Valley Vital Medicine, if we've recommended this therapy to you, we won't need to see you on that day. Just the technicians will, unless they have some specific questions for us. Otherwise, you actually don't need to be seen by us as a provider at all to be able to do an intake and figure out if this is right for you. So you can actually come right into the clinic, do a direct consult with the technicians, and get started with this without needing to see myself or other provider here. So it's important that we set expectations for the therapy as well. So everybody's brain is different. We don't know how your nervous system is going to respond. So it's important that we set reasonable expectations and goals. So we want you to come in for sessions, and I would expect you to do twice a week for 3 weeks. Then oftentimes what will happen is we'll transition to once a week for 3 weeks, and then it'll transition to every other week, and then it'll transition to every third week and once a month until we get to a place where, frankly, the results that you're seeing just continue to last and you don't need the therapy anymore. Like we said, this can take up to 12 to 20 sessions. So we are working to achieve enduring sustainability. In other words, this result is permanent, which again, I love. This is not something that you're reliant on. So changes in the brain that are absolutely lasting. Now, we have had some clients that have called us 6 to 12 months later and said, hey, you know what? I need to get in for a tune-up. They come in for one more session, and then after that, they don't need it anymore again. So we also expect to do your first session the first time that you come in. So after you go through your intake, you will get a session done for you that day. So preparing for your session. So it is important that you please come in hydrated. Hydration is really, really important in how your body functions. Eat a good meal prior to coming in, because it's important to have good balanced blood sugars as well. And ideally avoid a lot of simple carbohydrates and sugars. Okay. Now, when you come hydrated, it's also important that you make sure that you get enough electrolytes in. Okay. So make sure that you're focusing on that. Prior to your initial session, so fill out the IASIS Neurofeedback assessment, and you'll do that here in the office, or perhaps you'll get paperwork in advance if you stop by the clinic to grab that, and any additional paperwork that's required. So we'll want to update any relevant information in your patient portal. We'll have you watch some educational videos. And then if you have questions, we'll make sure that we get those answered for you. So after your session, so you can expect to receive a feedback form in your patient portal about 24 hours after your session. That helps us to measure any changes in your behavior, symptoms, sleep, energy, mood. This is really, really crucial for us and for the technicians to be able to provide you with the best care that we can and determine your protocol as you go forward. Make sure that you stay hydrated and consider asking close family members and friends for any feedback, because sometimes the changes that we see as we go through our days are somewhat imperceptible to us. And your kids, your spouse, your other friends that you're close to may notice changes that you don't even notice yourself. So we've got a couple of testimonials from our clients, so we'll listen to those real quick here.
For the IASIS Neurofeedback, what we have found is that, first of all, it's painless and super comfortable to do, because you just sit in a nice quiet office and there's quiet music playing, and all you feel afterwards is a little bit of zen. Everything is just a little bit peaceful. The neurofeedback in particular for my 12-year-old daughter has been absolutely life-changing. I think we probably did 3 or 4 sessions before we started to see little changes happening for her, and then it was just huge improvement at every session, to the point that all of a sudden she would be comfortable speaking to providers, comfortable giving her order in a restaurant, smiling, really playful banter with us at home. All these things that we'd sort of forgotten were part of her because we hadn't seen them for quite some time. And everything about her just relaxed. It's been really, really fun to get to see her come to life again. And I've actually started doing it with my 14-year-old son as well, who has ADHD, a lot of sensory sensitivities. His movement is a little bit slower. You know, his brain pathways are a little bit more rigid because they've been there for a long time. So one thing I've noticed with him is on the drive to school, because we do neurofeedback first thing in the morning, he is so happy. He's smiling, he's talking, he's engaged with me, and it's really lovely. And we've been seeing this change happen really slowly every time we do neurofeedback. It's a little bit more. My name is Elizabeth. I'm a clinical social worker with the healthcare system. I have 2 kids, a dog, and a couple cats. For about the past year, my 12-year-old daughter has been experiencing increased anxiety and depressed mood. She also stopped having much interest in food, and her weight wasn't necessarily going down, but she was continuing to grow with her weight staying the same. So her body mass index was decreasing significantly. We had tried therapy. We were trying pharmaceuticals to support her mood disorder. It wasn't enough to get through to really support change. So we came here looking for neurofeedback to see if we could work with her brain in a different way to support her to develop better coping skills and just have a more balanced mood. We chose Valley Vital Medicine because we wanted a more holistic approach to healthcare. I felt like we needed to reach a little bit further, and I really like that there's a functional medicine provider here that allows us to look a little bit deeper and do different types of therapies that we can't access in other types of clinics. My daughter really enjoys the IASIS Neurofeedback. She comes now every 2 weeks just for a little top up, and she looks forward to the feeling of peace that she gets during that session, and it lasts for her. It doesn't just, stick around for a little bit of time and then go away by the evening. It actually maintains in her because we've been doing it and we found our sweet spot for her. So we've been really pleased with the IASIS Neurofeedback, and we're definitely a family who's all going to be utilizing it now for sure. If anybody ever had questions about the IASIS Neurofeedback or any of the services, the people here in the clinic are really welcoming, very willing to answer any questions. They have so much information to offer and everybody wants to help. And so I think it's always worth just calling and asking or talking to Trevor. But the neurofeedback has been our favorite so far.
What an amazing story. Absolutely love that. Yeah, it's been such a pleasure to work with Elizabeth and her family. We got one more here with Amber.
It was during IASIS this last 3 months, I would say, when we've been doing that I have felt like myself again. I feel like I have a helmet over my head. That sounds really weird, but I have like a protection over my head right now after doing IASIS. Like there's something protecting it from getting a migraine. Anybody with a migraine knows you start to get like an inkling in your heart or your mind or your spirit that tells you you're going to get a migraine, and there's nothing you can do to stop it. It's the worst feeling. And so I would get that inkling, and then something would stop and it wouldn't turn into a migraine. Now, that's not to say that I never have had a migraine since having IASIS, but I would say they're much less painful, they're much less debilitating, and much less frequent. I think the thing I really appreciate about Trevor is that I feel like he's being honest with me. I don't feel like he's just giving me an answer because that's what he's supposed to say. Because I think sometimes in the medical world, you can walk in and they use all this medical jargon and they kind of try to convince you. And he just listens and then tries to help. He might not know, and it might not have the results that we would hope. Like even with IASIS, he said it works for many people, but it might not work. And just realizing that he would not pretend he knows everything. I really appreciate his honesty. Hi, my name is Amber Dahl, and I'm 45 years old, and I have 4 kids. And my profession is I am a stay-at-home mom, taking care of the kids and doing all the things. So I chose Valley Vital Medicine because I have had really good results in the past, as I've tried Trevor, talking to Trevor, doing the things that he's suggested. I actually know Trevor on a personal level. His wife is my good friend, and so she's had her own health struggles too. So knowing that they've walked their own medical journey and they've tried different things, I know that he has tried a lot of his own things that he's giving to us. And so I chose to, entrust him with our medical needs, and he just is always honest and straightforward, has great suggestions, things to try. I started coming to Valley Vital Medicine a couple years ago for my son who has cerebral palsy, and he was having some issues with his digestion and a few other things. So we started seeing Trevor, and he suggested different things to help my son, and I really appreciated it. And then my other son, just recently, I had some issues with his lack of wanting to eat food, different things related to the trauma that he had when he was in foster care. So I was asking for some help from Trevor to try and get through those things. And so Trevor recommended doing IASIS. And as he explained IASIS out and the different things it could help with, I realized it was probably good for not only my oldest son, but also my other son who has cerebral palsy, and my daughter and myself, because we had a lot of trauma, which led for me to migraine headaches. They'd be off and on for the past, I'd say even 20 years, but more frequent and more painful in the last 4 years. I would get them 2 to 3 times a month. Of course, with my headaches, I first went to my primary care doctor and she gave me the usual headache medicine, and it would help mask a little bit of the symptoms, but it didn't give me long-lasting results. My family has experienced some really good things since working at Valley Vital Medicine. I have seen our home life improved and our sleep has improved. Just seeing how my kids can sleep through the night, it has eased their anxiety. It has helped my kids when they're in school, has helped them with their concentration. My one son has cerebral palsy and his handwriting is not great because his hand is weak. However, since we began IASIS, his handwriting has improved. And so his performance in school has improved. My daughter has really struggled with racing thoughts, anxiety, concentration at school. And I have noticed her handwriting has improved. She's taking her time to do her best. She seems less anxious. I'm just so thankful. I'm very thankful for trying it. I'm thankful that my kids and myself, we've had good results. The people are amazing here. They are so kind. They are helpful. They are full of grace. I come in with my kids and we're kind of loud and we're a little disruptive sometimes. I mean, we try to keep it quiet as much as you can, but they are so kind, helping out, getting my kids a snack while I'm getting my IASIS. I mean, they're super flexible. If I'm running just a few minutes late, I mean, they give me grace. They're super people, and I just really love coming here.
I get goosebumps getting to hear that feedback and just the kind words that both Elizabeth and Amber shared. And so thank you so much again to them. I just want to publicly say thank you to them for sharing that feedback and their testimonials. And it really truly has been an honor and a privilege to be able to work with them. And it's just fun to be able to see the results that people are seeing from this technology in particular. Now, to further wrap this up and put a little bit of a bow on it, this technology is not just frou-frou, we think this works. Okay, there are studies that have been done that prove that it works. So here's just 3 of the studies that have been done. Most recently, you can see there at the bottom, there's one that was done in 2024. So super recent, up to date. And what I love about this is we see people's lives change in a short period of time, and the results last, and the results speak for themselves. And so thank you so much for taking your time to listen and be here watching this presentation. If you have any questions for us, please reach out. Our phone number is 701-532-1926. Otherwise, just check us out at valleyvitalmedicine.com. You can email us at frontdesk@valleyvitalmedicine.com, and we would love to have you come in, do a free initial eval, chat with the technicians to see if you are a great right fit for this. So thank you again so much for being here and for listening to this presentation. And we hope to be able to see you soon. Have a blessed day, and God bless.